Hi everybody, this is Matt. Today we're continuing this series on the cardiopulmonary system, and we are going to cover the pulmonary veins. The pulmonary veins are very important. They are the conduit back from the lungs with oxygenated blood. And this conduit is a valveless system, and there are two that actually empty back into the left atrium. And again, I would like to thank the authors and publishers of Fonctionnelle Anatomie for their beautiful diagrams here. This first one is just tremendous. This depicts both the entire arterial and venous circulatory system of the body in one diagram. So this is good stuff. And this is it here. So what we're going to focus on first is number 24. Number 24 is a depiction of the pulmonary veins, and they are bringing the red depicted oxygenated blood back from the lungs. This is essentially the lungs above the pulmonary veins, and the diagrammatic presentation of the blue venous blood coming to the lungs, and then via the alveoli picking up oxygen, and then returning via the alveoli, or I'm sorry, the arterioles, to the pulmonary veins, then back to the left atrium of the heart. So, and once back at the left atrium, the mitral valve, if it's closed appropriately, you will get excellent filling, and then the blood will move on to the left ventricle. So I just want to back out and give you an overall view of the circulatory system. In the center you see the heart. In blue you see the presentation of the venous blood returning back from the body to the heart, and then after the blood has the venous blood has gone to the lungs, it comes back oxygenated to the left side of the heart, again via the pulmonary veins to the left atrium, and then eventually to the left ventricle, and then pumped out to the entire body. This other presentation is also wonderful. This is an anatomical presentation of all the different layers of an artery, and you can see how muscular that is, and how that is so capable of performing its job for some people up to 100 years. So anyways, that is one presentation. Then there is one other diagram that I wanted to show you because it also does a nice job of presenting the flow of blood back from the lungs to the left atrium. And that is this presentation. You will see the two larger arrows. They are the pulmonary veins bringing the blood back from the lungs, oxygenated, to the left atrium. And that is, again, a very clear anatomical presentation of what we are speaking of. Another small piece of information regards to pulmonary veins. It has been studied over the past decade or so, the role of the pulmonary veins in atrial fibrillation. We'll go into more detail about that in the detailed segments of electrophysiology, but the pulmonary veins are important and have, through research, been determined to play an important role for the initiation of the atrial fibrillation signals, and is also involved in interventional procedures to do ablation of the ostia of the pulmonary veins to be able to terminate atrial fibrillation. But that will come in a later presentation on electrophysiology. And that is it for today. Have a great day.